Welcome back to WEF Tech Live. I am the host, Travis Loop. We're going to talk about wastewater disease surveillance now, joined by Amy Kirby from the U.S. Centers for Disease Control and Prevention. She is the lead for the National Wastewater Surveillance System. And the Water Environment Federation has been a partner with CDC over the past few years working on this issue. So I guess just a big open question. How is it going with the National Wastewater Surveillance System, which was really ramped up because of COVID? What's the status? What's some of the successes and so forth?
Yeah, it's really been amazing to see how much the system has grown. We only turned 2 years old last month, so we were established in September of 2020, so just over 2 years old. And we already have 1,200 sites that are submitting data into CDC twice a week, giving us the data that we need to protect our communities from SARS-CoV-2. And those 1,200 sites represent 40% of the U.S. population and is continuing to grow. So it's really been impressive to see how quickly communities have been able to engage with this, and utilities, of course, are a really important part of that. If they're not able to go out and collect the samples and get them submitted to the lab, we don't have a wastewater system. So I have to give a big shout out to all of our wastewater partners that are really the heart of the new system.
Yeah, I realized I probably should have asked for a quick explanation of how wastewater surveillance works.
Sure.
I just assumed a lot of our audience would know this, but yeah, could you talk about that?
Sure. So basically the idea is we know that for many pathogens like SARS-CoV-2, which is the virus that causes COVID, that pathogen is shed in feces. And so you can test individual people through their stool, or you can use wastewater as sort of a pooled stool sample to represent the whole community. And so that's what we're doing. We collect samples at the wastewater treatment plant, test them for the virus that causes COVID, and using that information, we can understand trends in the community. Are cases going up? Are they going down? Are they very high, very low? Where are we going to be in the next 2 weeks?
It's fascinating. I know one of the interesting things I saw was how universities were using it to be able to kind of get a sense about a whole dorm building's status. And, well, maybe we don't need to test these 500 students, but if we see something in the wastewater, then we'll take action. So a lot of different applications of this.
Yeah, it's turned out to be a really great approach for monitoring populations so that you know when to go in with more expensive, frankly, interventions. So we've seen it at universities. Correctional facilities have also used it with the same approach. So they monitor wastewater coming out of that building. When they start seeing evidence that they're cases, they can go in and do more testing and put in interventions like masking and isolation and things like that. And it's been very successful in controlling those outbreaks.
Sure. So this system, network has been built up over the past 2 years, and now it's, I think, been involved in a couple viruses that have shown up, Monkeypox and then polio. Could you talk about the role of wastewater surveillance with those two?
Yeah, absolutely. So I first want to step back and say that although the system was built for COVID, we knew from the beginning that it could be what we call a surveillance platform. So it could enable us to look for a lot of different things and be very responsive to changing public health needs. And this summer has been very much a test for the system, and I think we have succeeded. So we saw monkeypox come to the U.S. There were questions initially of whether wastewater surveillance will work, but it does. So it works the same way for monkeypox that it does for COVID. And so we've been able to rapidly deploy monkeypox surveillance. We got data coming in nationwide starting this month. So we'll be able to monitor and hopefully confirm that that outbreak is in fact ending, which is what our case data is showing us. Polio is a little different. So we've been doing wastewater testing for polio for decades. It's the grandfather of wastewater surveillance. But we've never used it in a fully sewered system where people are highly vaccinated against polio. And so nationwide surveillance doesn't make sense in that setting. And so we're thinking about how we can identify communities that are particularly at risk for polio. And basically that's where we have low vaccination rates, and use wastewater surveillance to monitor those communities and make sure that we're not seeing spread into those communities.
So what's next? How does the program continue to get built? What other aspects do you add? Yeah, just kind of what's in the works, if you will.
Yeah, so two things. So one is coverage. We want to expand past that 40% coverage to get more communities online. And that's really one of the reasons that we're here at WEF Tech. We want to hear from utilities what are their challenges to participating in wastewater surveillance. so that we can work to minimize those challenges and make it easier for them to participate. So that's one, extend coverage to the extent we can. And the second is expanding to other targets. So we can always do these response targets like monkeypox and polio, but there are some really core health issues that wastewater surveillance can help us address. And so we're looking to build capacity to look at antibiotic resistance, foodborne infections like E. coli, salmonella, norovirus, influenza, so another respiratory pathogen that we can detect in wastewater, and the emerging fungal pathogen Candida auris, which is thankfully rare, but very, very severe. And so any data we can get on that pathogen is really helpful to help us mitigate those effects.
I have not heard of that, so I'm going to have to educate myself a little bit and do some Googling here and read the CDC's website as to what they say. I always look for the credible sources here. What have you heard over the past 2 years about why water utilities are doing this? Like, what's their positive reaction to being part of this, or their motivation that you're hearing?
Yeah, so initially in 2020, it was very much, wanting to be able to help with the COVID pandemic however they could. I think that is still the overriding reason. But it's really, at its heart, wastewater utilities are about protecting public health and making sure that our water systems are safe. And so expanding that role into surveillance for public health is really sort of a natural expansion for wastewater utilities. And so that's what we're seeing, and the reason they want to do that, to help their communities, to provide information to keep not only their communities but their own families safe, has really been a big part of it. So we are endlessly grateful for their support, because it would not happen without them.
Sure. On the other side of the coin, you mentioned you're here at WEF Tech to try to learn a little bit more about maybe what some barriers are or some hesitancy to doing this. Do you have some sense of what some of those reasons are, or maybe why the system hasn't been expanded to as many utilities as you'd like? We
do. So the main reasons that we hear are around resources, and that's sometimes staffing. So at very small utilities, they may not have enough people on staff to be able to do the sampling and get the sample to like a FedEx or courier service. And so that's a limitation. There can also be a limitation around equipment. The best samples are collected using an auto sampler that collects a 24-hour composite sample. Small utilities may not have that. And so we've partnered with WEF to have an auto sampler provision program so that we can overcome that barrier. And frankly, another barrier is funding. This costs money to collect these samples, and utilities are already working on tight funding lines. So we're hoping we can identify ways with some of our partners to help overcome all of those barriers, including funding.
Sure. Well, I know we at the Water Environment Federation are happy to work with you all on trying to grow that. I wanted to ask you lastly what it's been like. You're a public health professional at CDC. What have you learned about the water industry from this work the past few years?
I mean, I've always been a water nerd and a fan of the water industry, so I came in predisposed to really be impressed. But I think one of the things that has really struck me, especially here at WEF Tech, is how much science goes into the wastewater industry. I'm walking around seeing microbiology, chemistry, engineering, data science, communications, it's all of those things. And all of that goes into public health too. And we have this very similar, when we do our jobs right, no one sees it. And so I think there's a lot of synergies and familiar feelings between the public health sector and the wastewater sector. And I know I can speak for the rest of the news team that wasn't able to join. They are so thrilled to really be part of the wastewater community and bringing that public health perspective, and look forward to deepening that relationship over hopefully many years to come.
So this is your first WEF Tech.
It is my first WEF Tech.
Okay, yeah,
yes.
It's incredible, isn't it?
It is. Yes.
Over 800 companies here, so much technology, equipment, and services. So glad it has been impressive for you. Well, Amy Kirby from CDC, thank you for this conversation. Thank you for the partnership, and we look forward to continuing it into the future. Thank you.